Hello, and welcome to my presentation. Today I'll be talking to you guys about substance-related and addictive disorders. So without further ado, let's continue. So the agenda for today, first I'm going to go over some background information about substance use in addictive disorders. I'm going to go over the prevalence rates of today, and then I'm going to go over some common substance-related addictive disorders with you guys. Then we're going to transition and talk more about the DSM-5 criteria. There's a lot there to go over. Then talk about the severity of it. We're going to go over some treatments, some medications, and some side effects that go along with treating addictive and substance use disorders. And we'll end with talking about some alternative treatments that also work. So a lot to go over today. All right, so to begin, some background information about substance use and addictive disorders. So, substance-related and addictive disorders really involve the use of drugs, alcohol, or behaviors such as like gambling that interfere with daily life. These disorders often include cravings, loss of control over use, and continued use despite negative consequences. They affect the brain's reward system, making it harder to stop the behavior, even when someone wants to. The DSM-5 classifies these into the substance use disorders, such as alcohol, opioids, or stimulants, and non-substance related disorders, such as gambling disorder, um, and other things like that. Also, pharmacology helps us understand how substances affect the brain and its behavior, and this knowledge really guides treatment, which can include medications, therapy, or a combination of both. So now to get into the prevalence. Substance-related and addictive disorders continue to really significantly impact the U.S. According to the 2023 National Survey on Drug Use and Health, approximately 48.5 million individuals aged 12 and older, representing 17.1% of this age group, had a substance use disorder in the past year, which is huge. Alcohol use disorder also was identified for in 28.9 million people, while 21.5 million had a drug use disorder. Notably, marijuana use disorder was the most prevalent among drug use disorders, affecting 6.8% of individuals aged 12 and older. Um, the prevalence of substance use disorders was also highest among young adults aged 18 to 25, with 27.1% experiencing a disorder. Additionally, the severity of these disorders varied. 55.9% of those with a substance use disorder had a mild form, and 22.7% had a had a mild form, and 22.7% had a moderate form, and 21.5% had a severe form. So despite the high prevalence, a significant treatment gap exists. But in 2023, only 23% of individuals aged 12 and older who needed substance use treatment received it. And moreover, among adults with a substance use disorder, 94.7 did not perceive a need for the treatment. And I think there's just a lot of stigma that goes into this, with substance use disorders and really just any addictive disorders in general. So I think that's why we see these numbers so high. Why people are not receiving treatment. I mean, 94.7% of adults didn't receive that. Didn't even think of getting treatment is crazy in my opinion. So now we're going to talk more about some common substance related and addictive disorders. So alcohol use disorder. So it's obviously a pattern of alcohol use that involves problems controlling drinking, continued use despite issues and withdrawal symptoms when not drinking. Or opioid use disorder again involves misuse of prescription pain relievers like oxycodone or illegal opioids like heroin, leading to dependence, cravings, and overdose risk. Stimulant use disorder. Again, this involves drugs like methamphetamine or ADHD medications, misuse for energy, focus, or euphoria. Again, often resulting in addiction and mental health effects. Cannabis use disorder. Again, this is ongoing problematic marijuana use that affects responsibilities, mood, and motivation, especially in teens and young adults. sedative, hypnotic, or anxiolytic use disorder. Again, this is misuses of medications like benzodiazepines, like Xanax. It's used for anxiety or sleep, can cause like dependence and dangerous withdrawal. Tobacco use disorder. I actually just did a presentation on tobacco in my substance use class. Again, this is the chronic use of nicotine containing products like cigarettes or vapes, really leading to a dependence and long-term health risks. And nicotine is actually the most addictive drug out there. And then gambling disorder. Again, this is a non-substance related, but it's the repeated problem of gambling behavior that causes distress or harms personal relationships, work, or finances. So these are all just some examples of substance related and addictive disorders. Now I'm just going to get into the DSM-5 criteria. So the DSM-5 provides a set of 11 criteria for diagnosing substance use disorders. These apply broadly across different substances, like alcohol, opiates, or stimulants. A person must meet at least two of these criteria within a 12-month period to be diagnosed, and the severity depends on how many criteria are met. And so these are just some of the you know criteria. So like taking the substance in larger amounts for or for larger than intended, wanting to cut down or stop but not managing to, spending a lot of time getting, using, or recovering from use of the substance, cravings and urges to use the substance, not managing responsibilities at work, home, or school because of the substance use, continuing to use even when it causes problems in relationships, giving up important social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts you in danger, and continue to use even when you know you have a physical or psychological problem that could be worsened by the substance, needing more of the substance to get the same effects, and developing withdrawal symptoms, which are relieved by taking more of the substance. These are all kind of like criteria. And then some severity levels with substance use disorder. So again, severity is based on how many of the 11 diagnostic criteria are met within a 12-month period. So for it to be mild, it would have to be 2 to 3 symptoms, early signs of problematic use. They may still, the person may still be able to function in daily life, but with warning signs like cravings or minor disruptions. If it's moderate, there would need to be 4 to 5 symptoms present. There needs to be a clear pattern of harmful use, noticeable impacts on work, relationships, or health, and increased tolerance and or withdrawal symptoms may be present. And for it to be severe, there would need to be 6 or more symptoms present. And this would be like a significant loss of control, major impairment in daily functioning, and really often involves physical dependence, high risk of relapse, and serious health and social consequences. And so that's when you see it really bad. And then moving on, I also include the DSM-5 criteria for gambling disorder because it's a little different, obviously, because it's not a substance. But to be diagnosed, you need 4 or more of the following must occur within a 12-month period. So preoccupation with gambling, again, reliving the past experiences, planning the next one, needing to gamble with increasing amounts of money to achieve excitement, repeated unsuccessful efforts to control, cut back, or stop gambling, restlessness or irritability when trying to reduce or stop gambling, gambling to escape problems or relieve feelings of helplessness, anxiety, or depression, chasing losses, again, gambling to recover money lost, lying to family members, friends, or others to conceal the extent of gambling, jeopardizing or losing important relationships, jobs, or education or career opportunities due to gambling, and relying on others to financially support gambling related debts. And then same thing, severity levels with gambling disorder. Again, severity is based on the number of criteria met within a 12-month period. For it to be mild, there would need to be 4 to 5 symptoms present. And gambling in the person that has a mild gambling disorder, gambling may cause noticeable stress or life disruptions, but the person may still maintain some control or insight. For it to be moderate, it would need to be 6 to 7 symptoms present, and this would be an increased loss of control, really more serious consequences like financial strain, damaged relationships, and difficulty stopping. And for it to be severe, need to be at least 8 to 9 symptoms present. This would be persistent, compulsive gambling behavior with significant impairment in daily life, finances, mental health, and relationships. Important note I just wanted to add um, that I thought was really important is that gambling disorder is the only DSM recognized non-substance related addictive disorder as of right now, but the field is growing as more behaviors show similar patterns and of compulsive use and impaired control and life disruption. So yeah, the DSM is the only gambling uh, is the only DSM recognized non-substance related addictive disorder as of right now, but it's looking to expand that. Um, and so beyond gambling, what are some future non-substance addictive disorders that might be added to the DSM one day? Well, internet gambling disorder. This is actually already included in the section 3 of the DSM-5. Conditions for further study. This again involves excessive uncontrolled gaming that interferes with daily life, common symptoms, withdrawal when not gaming, loss of interest in other activities, and gaming despite harm. Compulsive sexual behavior disorder. This is recognized in the ICD-11 by the World Health Organization. This is characterized by repetitive sexual activities that feel out of control and can cause distress or impairment. It's also controversial as there is debate over distinguishing compulsive behavior from high libido. Um, Shopping addiction, compulsive buying disorder. Again, this is linked to emotional regulation and impulsive control. It's often associated with anxiety, depression, or stress, and people may shop to relieve negative emotions, leading to financial problems and guilt. Social media and internet addiction. This is really increasingly seen in younger populations. It may involve compulsive checking, fear of missing out, like FOMO, and neglect of real life responsibilities or relationships. And again, this is still debated too, due to how common and culturally recognized, culturally normalized excessive use is. And then exercise addiction, when physical activity becomes compulsive and interferes with health or daily responsibilities. This can be tied to eating disorders or body image issues. And then some warning signs, again, withdrawal symptoms, anxiety, guilt, when unable to exercise. So now we're going to talk about some treatments. Some treatments for substance use and addictive disorders. Big one, CBT, cognitive behavioral therapy. It focuses on identifying and challenging unhelpful thought patterns and behaviors tied to substance use. Helps people develop healthier coping strategies, manage triggers, and prevent relapse. And it often includes skill building for stress management, problem solving, and emotional regulation. Motivational interviewing. This is a really big one. We talked about this a lot in my substance use class this semester. Again, it's a collaborative, non-confrontational counseling style that really helps to enhance internal motivation to change. Therapists help clients really explore ambivalence about quitting and build confidence in their ability to recover. And it's especially effective really in the early stages of treatment or for people who are unsure about change. So motivational interviewing is a big one. Contingency management, again, this provides like tangible rewards like vouchers, prizes, or privileges for meeting treatment goals like negative drug test or consistent attendance. It really reinforces positive behavior through immediate incentives, which can really help sustain motivation. It's particularly effective for stimulant and opioid use disorders, and then the 12-step facilitation therapy. Again, we were just talking about this the other day in my substance use class. It's a structured approach really designed to increase engagement in 12-step support groups like Alcoholics Anonymous or Narcotics Anonymous. And it really emphasizes the three key principles: acceptance of addiction as a chronic illness, surrender to a high power with the support of the group, and active involvement in the 12-step meetings and sponsorship. It really builds accountability, peer support, and really long-term recovery networks for people. And so some medications and side effects, you know, for treating these disorders, for opioid use disorder, methadone's a big one. For its use, it reduces cravings and withdrawal, blocks euphoric effects of other opioids. Some side effects could be constipation, sweating, drowsiness, respiratory depression at high doses or risk of dependence. I'm sorry if I butcher this word, but buprenorphine. I want to say I say that right. It's a partial opioid agonist, and its use again reduces cravings with a lower risk of overdose. Some side effects: headache, nausea, constipation, insomnia, potential for misuse. It's lower than methadone. This is a big one, naltrexone. Again, this really blocks opioid receptors, prevents the high if opioids are used. Again, side effects: nausea, headache, fatigue, liver toxicity, excuse me, and injection site reactions for injectable form. Alcohol use disorder. Some medications and side effects for this. Again, disulfiram. I think I said that right. Again, it creates unpleasant effects: flushing, nausea, palpitations if alcohol is consumed. Some side effects: drowsiness, metallic taste, liver issues, risk of severe reaction if alcohol is consumed. Again, naltrexone is used for this too. Its use again reduces alcohol cravings and pleasure from drinking. Side effects are the same as above. And then a can sorry if I butchered this word, a camprosate. I want to say I said that right. Camprol. Again, it helps maintain abstinence by restoring brain chemical balance. Some side effects can be diarrhea, anxiety, insomnia, and muscle weakness. So a lot of medications there. Some medication side effects continued for nicotine use disorder. There's nicotine replacement therapy like nicotine patches, gum, lozenges, lozenges, excuse me. And the use it reduces withdrawal and cravings by supplying a low, steady nicotine. Some side effects could be skin irritation with the patch, hiccups with the gum, or mouth soreness. Bupropion, I don't know if I said that right. Again, this uses an antidepressant that reduces nicotine cravings. Side effects include insomnia, dry mouth, agitation, seizure, and risk. Varenicline, yeah, I think I said that one right. The use reduces withdrawal and blocks effects of nicotine. Some side effects: nausea, vivid dreams, mood changes, and sometimes suicidal thoughts. And SSRIs, these are huge, selective serotonin reuptake inhibitors. Again, these are big. Fluoxetine, like Prozac, paroxetine, Serotilin. Sorry, I'm butchering these words today. Why they're used: they help reduce mood and reduce impulsivity and obsessive thinking associated with the addiction. And some side effects are nausea, insomnia, or drowsiness, sexual dysfunction, weight gain or loss, or increased anxiety early in treatment, usually temporary. Those are some medications and side effects. And some alternative treatment. There's obviously inpatient and residential treatment. This is 24/7 supervised care in a structured setting. It's ideal for severe addictions, high relapse risk, or co-occurring mental health disorders. This includes detox, individual and group therapy, medication management, and aftercare planning. And stays can really range from 30 to 90 days or more, depending on the need. Then there's outpatient treatment. Clients live at home but attend regular therapy sessions at a clinic or center. It offers flexibility for those with jobs, school, or family responsibilities. Levels vary. The standard outpatient is 1 to 3 sessions per week. Intensive outpatient programs are usually 3 to 5 days a week, with several hours a day. And then there's partial hospitalization programs that are more intensive, like day treatment. And then some other treatments: mindfulness and meditation really increases awareness of cravings and triggers that helps reduce anxiety and impulsivity. Yoga and breath work, this really improves physical and mental balance, really helps release tension and increase focus. Art and music therapy, this really provides creative outlets for processing emotions and trauma, often used in trauma-informed programs. Physical exercise, and like nutrition and sleep support. So these are all great alternative treatments for dealing with these disorders. And yeah, those are my references, and that's my presentation. If you guys have any questions, please feel free to reach out. And yeah, thank you for listening to my presentation.